Ladies and gentlemen, another special day taking us from one angle of the country to another in a special move to give you just what the profile is expected for you to know. And this time around, we take you from the littoral region, traveling several kilometers over to Boya. And this time around, we shall be talking issues of health. And of course, we say welcome to FOKO Heart Center. It's a specialized center that caters for issues revolving around the cardiac. Be with us, for you will enjoy this program. I will be right back.
Hello, my name is Dr. Ebai Ethel. I'm the medical doctor, the general practitioner in FOKO Heart, and you are welcome to FOKO Heart Center.
I'm Eno Cynthia. I'm the communication officer of FOKO Heart. Here we have the receptionist, like the doctor earlier said, that you are welcome to FOKO Heart. So we'll be moving straight to the other ward so that you know more about FOKO Heart. Okay, as you can see, this is day area, the ward where when patients come, they'll be on observation. So patients will be here on observation. So the doctor is going to tell us more on the different equipments we have here in this ward.
This is the day area of FOKO Health Center. The day area will be for people who will be here for observation, for monitoring, but who will not sleep overnight. And then monitoring will be very intensive. We have individual monitors placed constantly on patients to monitor their vital signs, to make sure that if there is any abnormality, we can always detect it. There are different types of monitors that measure different things, and they will be assigned to patients depending on what we have, and depending on what they have, and depending on what we intend to monitor. So for each bed, there are vital parameter monitors. There are also oxygen outlets from the wall where we connect oxygen in case a patient needs the oxygen, so that we don't have any difficulty with that. For example, this is one of our vital parameter monitors. It is called a Dynamap, and it's a specialized monitor. It is very reliable and very sensitive. It has an alarm which will signal if there is any abnormality in any of the vital parameters in measures. It will be constantly connected to a patient, and the vital parameters will be measured. So there is no abnormality that we will not detect immediately, because the monitors will always be connected to the patient. So this is one of our monitors called a Dynamap. We have other vital parameter monitors which not only give vital parameters but also give electrical activity of the heart constantly, especially for people who have had abnormalities in the conducting fibers of the heart and many other diseases that could affect the heart in any way. It shows us cardiac activity. So at any point you can come and look at how the heart is faring from this monitor. It is one of the most important monitors we have, and this will be constantly connected to a patient who will be either in the day area or in the intensive care. So we have several of these machines always connected to the patient.
Okay, you're welcome to the intensive care. This is the area where a doctor, a nurse, and a caretaker are going to be with the patients, and everything will be provided for the patients in this ward. As usual, the doctor is going to enlighten and give us more knowledge with the machines we have in the intensive care unit.
This is the intensive care area of the FOKO Heart Center. As the name implies, the intensive care means care from every medical personnel will be really intensive, from the doctor to the nurse to the nursing assistants. First of all, we will not have any patient carers taking care of their patients. Everything will be handed to them, from their clothing to the care from the nursing assistants. They'll be like their own carers, and we have sophisticated machines to detect any abnormality in the vital parameters. We also have electrocardiograms on standby for any if we have any need. We have defibrillators for those who need cardioversion. We have monitors, more sophisticated than in the day area, to constantly monitor the vital parameters, which will be taken almost every 15 to 30 minutes. And then we have oxygen outlets for each bed, and it will be regulated depending on how much the oxygen the patient needs. We'll also have the nursing area with very big windows, so that at any time the nurses can always take a look at how the patients are faring and not just wait for the patients to call their attention. Each bed has a button by it which communicates with a watch given to the medical personnel, which will alert them if the patient presses the button, and will indicate which bed it is, so that they can immediately attend to that patient. So we will take care of everything, from their dressing to their personal care, taking care of their bathing and changing of sheets, and then food will come. Food will come from the hospital. There will be no external food, and the food will be specially prepared to meet the needs of the patient without giving them more infirmity or more diseases or altering their state. So we try to limit food. We won't have any food from outside. Everything will be prepared here, and everything will be handed to the patient here. We'll make them as comfortable as they can be in their state.
Okay, right now we are taking you to the VIP area of FOKO Heart Center. As we are entering the VIP room, you can see is really special for VIP people only. And the doctor is still going to give us more knowledge on the machine and how the VIP people will be treated, or how the VIP patients will be treated at FOKO Heart Center.
This is the VIP area of the FOKO Heart Center. And FOKO Heart has made it in such a way that the VIP area is really a VIP area. If you take a look, the room is well aerated with 2 windows. The mattress is very comfortable, and we have very clean and nice soft sheets. It is also it is separated from the general area, so the person has the luxury of quietness, and it's a restricted area. It also has you have a standby nurse assigned just to the patient in this VIP room, and a nursing assistant just for the patient in this room. They will have 24-hour attention, undivided, because they are VIPs, and we should treat them as such.
You're welcome to FOKO Heart Laboratory room. Yes, this is the lab where you have the most sensitive equipments and things here in the lab. And our lab technician, Richmond, is going to enlighten us more about the different machines found here and how the lab at FOKO Heart will operate.
Hello, ladies and gentlemen. You're welcome to FOKO Heart Laboratory. I am Mr. Nzive Richmond, a medical laboratory scientist. If we take note on the door, it is written, no direct entry, authorized personnel only. I know so many people will ask me why, but I will tell them the laboratory is the powerhouse of every hospital, or the powerhouse, or a cell. And what is a cell? We say a cell is the basic structural functional unit of all living organism, meaning without the cell, you cannot live, we cannot operate. And I'll say without the laboratory, a hospital cannot function fully. The doctor needs to confirm their suspicions in order to prescribe for our patients. Over here, as we see, FOKO Heart has a very small laboratory, but very sophisticated for cardiac analysis. We will start here with our full blood count analyzer. We call it a hematology analyzer, which measures about 20 parameters, such as the white blood cell count, the red blood cells, platelets, and hemoglobin, just to name a few. And over here, we have some of the reagents that go alongside with these machines. Over here, we also have what we call the spectrophotometer, which also aids in the diagnosis of so many cardiovascular diseases. We have parameters that it checks, like the electrolytes. Under the electrolytes here, we have sodium, potassium, chloride, magnesium, just to name a few. And we also have the kidney function tests here, such as the urea and the creatinine, the liver function tests, the ASAT and the ALAT, and the lipids, which are the cholesterol, triglyceride, LDL cholesterol, and HDL cholesterol. This machine also aids very much in the diagnosis of cardiovascular diseases, such as arteriosclerosis, which could further lead to stroke and heart failure. Over here, we also have a centrifuge, which also helps us to separate specimens, such as when we collect blood from our red tubes. We have a sample down here. And over here, we could see the purple tube and the red tube. These purple tubes are called the EDTA tubes, which are used for collecting blood samples, especially for hematology analysis. We also have our red tubes here, which are specifically used for collecting our biochemistry tests, blood samples for testing. And when bloods are being collected into this tube, this red tube, we have to put them into this machine to centrifuge them. We call this machine the centrifuge. It helps to separate blood from plasma. So this machine helps us to get plasma in order for us to run our biochemistry test. Over here, we have our standby backup machine, which helps us to store energy, such that when we have power outage, it will help us supply light for about an hour before our generator comes on. Over here is our step down, which also helps us to regulate the amount of current that flows into the laboratory. Over here is the small eye we call the microscope, where we use to diagnose a lot of parasites and a lot of diseases as well. And so on and so forth. This is just the laboratory for now. The laboratory is also expecting a machine that is going to be testing for D-dimer and troponin tests, which are also markers of cardiac heart failures. And subsequently, on the 1st of June, we are going to see the D-dimer machine.
Right here, we are inside the cubicle number 1. That is an area where investigations of patients are being done. So the doctor, as usual, will give us some of the details concerning the machines inside our cubicle.
In FOKO Heart Center, we have an entire area just for specialized cardiac investigations, and this is the first cubicle in the investigation area. It is the electrocardiogram room, and it's the first line test when it comes to cardiology investigations. It helps to give so much information when it comes to the heart. So we have put a room, we have assigned a room just for it, so that there is no mix-up, so that there's no delay for any patient. Because for most other institutions, it's the doctor who does it, but there's a room just for it. And we'll move to the second investigation cubicle. Here we conduct stress tests, and there are two varieties, the treadmill and the bicycle. For those who prefer to run, they can do the treadmill test. For those who prefer the bicycle, they can do the bicycle test. It's also a specialized cardiac examination. And the third cubicle is the tilt test examination. It helps to diagnose people who have episodes of loss of consciousness, fainting, they've not discovered the origin. It will help us because we give you medications while doing the test to be able to elicit different symptoms, and we'll be able to identify where the problem is coming from.
Okay, here we have the doctor's consultation room number 1. This is one of the consultation room, and it's different from the doctor's office. So after consulting with a doctor and whatever, the doctor can go back to his office. But this is the consultation room number 1, where doctors come in to consult patients. So I'm going to show you the consultation room number 2.
Dr. Fred Perry Kema was born in Buea, southwest region of Cameroon. He did his primary school education in Catholic School, Buea, and secondary education in Bilingual Grammar School, BGS Muliko, and St. Joseph College, Sase, obtaining his GCE, ordinary and advanced levels. He left Cameroon some 32 years ago to read medicine in Rome Catholic University in Italy. Dr. Fred Perry Kema is on the specialist register of the General Medical Council, London, UK, as a consultant cardiologist with full license to practice. He has been a consultant cardiologist since 2005. He has extensive international experience and reputation as he is currently operating in the United Kingdom and France. He is fluent in the following international languages: English, French, Lingala, and Italian. Dr. Fred Perry Kema developed an advanced echocardiology service in South London Hospital at the Royal Bolton Hospital and was awarded the title of Honorary Senior Lecturer in Cardiac Medicine by the University of Manchester in 2011 in recognition of his teaching activities at the Royal Bolton Hospital NHS Foundation Trust. He is a Fellow of the Royal College of Physicians, UK, and Fellow of the European Society of Cardiology. Dr. Fred Kema is trained in both invasive and non-invasive diagnostic techniques. He covers all areas of general adult cardiology with particular specialty. Dr. Fred Kema also runs specialist clinics including heart disease in pregnancy clinic, atrial fibrillation and stroke prevention clinic, heart failure clinic, screening and preventive cardiology clinic. Cardiology is a specialist branch in internal medicine dealing with the heart and great blood vessels. According to the World Health Organization report in 2014, cardiovascular diseases are the second most common cause of death, that is 11%, from non-communicable diseases in Cameroon. FOKO Heart Centre, with its purpose, is to build specialist cardiac center, which is situated in GRA, the Kokomembia, Boya, precisely between Boya Mountain Hotel and the Nigerian Consulate in the southwest region of Cameroon. FOKO Heart Centre delivers very high standards of care to people suffering from cardiovascular diseases. The care will be first class and affordable to the entire Cameroonian community and neighboring African countries. FOKO Heart Centre also serves as a University College of Cardiology and will liaise with the University of Manchester as part of an exchange program for undergraduates. FOKO Heart Centre in Buyam also serves as the headquarters of the Cameroon Stroke Association. The purpose of the Cameroon Stroke Association is to educate and prevent strokes. Strokes is definitely the number one cause of hospitalization and mortality in Cameroon. It is a major burden to our country and it is affecting young individuals below the age of 36. Dr. Fred Perry Kema also engaged in continuous professional development activities in the University of Buea. According to World Health Organization, cardiovascular diseases are a group of disorders of the heart and blood vessels. WHO also states that cardiovascular diseases are the number one cause of death globally. More people die annually from cardiovascular diseases than from any other diseases.
I thank you all, ladies and gentlemen, for showing up. The turnout is impressive, not only from a journalistic perspective, but also we have a series of patients coming from all over the country. We are extremely pleased, and like I said, today is the official launching of FOKO Heart Centre, Paris Specialist Cardiac Center, GRA Boya. This is a specialist cardiac center with a view to easing the burden of heart diseases and stroke on a national scale. As you know, at present, stroke is a major burden and lots of people are suffering from this condition. Our mission here is primarily to educate our people about the major risk factors of cardiovascular diseases and then to enable them have direct access to first-class care and finally offer them basic and necessary treatment with a view to prolonging lives from a cardiovascular perspective. However, we see a wide spectrum of patients with not only cardiovascular diseases, but we identify patients with specific cardiac conditions and keep them right here. That is, we hospitalize those patients. Those with non-cardiac conditions will be referred to other centers. And so far, I'm pleased to have identified lots of patients today with cardiovascular conditions. I'm so happy. I have been a cardiologist since 2002 and a consultant since 2005. And I think that in this country, there are several hospitals nationwide, but there is a significant shortage of specialist hospitals. And that's why you can see that the turnout is huge. I suppose if we came here as a general hospital, we won't have the crowd you guys are seeing. But as a tailored hospital with emphasis on stroke and heart failure, the satisfaction is impressive. Upon arrival in this hospital, you have the specialist nurses who will receive the patient and get basic information. You have the very important up-to-date cardiac monitor which gives you essential vital parameters. What does that mean? It means that upon arrival, the specialist nurses will get your blood pressure, your heart rate, temperature, oxygen saturation, your weight, and then present it to us. Thereafter, after thorough examination and history, we move on. Every cardiac center has an electrocardiogram done on the spot. The patient will just go straight for the ECG. The ECG means giving us an idea about the electrical activities of the heart. On top of that, it could also give us information about previous and ongoing heart attack and disease of the heart muscle. Thereafter, based on the information we have on the clinical history and of course examination, we then move on to next investigation, which is the echocardiogram. The echocardiogram gives us morphology and anatomy of the heart. So those are the preliminary examinations on the spot. If we are not happy or if there is need for urgent care, we admit the patient in our coronary care unit, that's inpatient care. And if we feel that the patient is stable enough to go home, based on our working diagnosis, we will arrange further investigations such as an exercise tolerance test, which is a stress test typical in patients with chest pain. Or if we feel that there is no need for that, but we move on primary prevention based on what we find, we might carry on optimizing treatment. So just to go straight, what services do we offer? We offer electrocardiogram, we offer echocardiogram, we offer a tilt table test. We are unique in the country to have a tilt table test. What's a tilt table test? A tilt-table test is an inclination test which helps to identify or to diagnose patients presenting with unexplained collapse or reflex syncope. That's in the midst of people, they suddenly collapse, but they are not established structural heart disease. FOKO Heart Center is the only center in Cameroon presenting a tilt-table test as a diagnostic tool for reflex syncope. So we are unique. So to round up on this question, what do we offer again? ECG, echocardiogram, stress echocardiogram, dynamic echocardiogram, tilt-table test, transesophageal echocardiogram, DC cardioversion, inpatient care. On top of that, we supplement our activities with a cardiac rehabilitation center, which I think you familiarize yourself with. I live in London, I operate in London and in Paris. All the phone calls we receive back from Cameroon are patients with cardiovascular diseases. Most of the time, stroke, most of the time, heart failure, most of the time, some of the symptoms, breathlessness, swollen legs, easy fatigue, lightheadedness. The overall impression is that. And on top of that, if you realize that our predominant primary condition in this society is hypertension, the endpoint of most cardiovascular diseases is heart failure, and therefore there are all elements to suggest that people presenting with breathlessness, palpitations, lightheadedness, swollen legs, and of course distended abdomens could be suffering with an underlying cardiac condition. The first thing is we created this facility from a humanitarian perspective to help our people after having done so much abroad. One of the reasons why this place is so affordable and is overcrowded today is, for example, an ECG, electrocardiogram, cholesterol blood test, plus an echocardiogram for 20,000 CFA. No one will do that on earth except us. But the quality is there. What does that mean? It means that I see patients from Cameroon, from Senegal, from Ghana, from France, from London, in London and in France. The same service I provide there is the same service I'm providing here. So the quality is there. The only difference is that in London, to see me, you pay about £250, which is an equivalent of about 180,000 CFA. In France, to see me, it's about 200 euros, which is an equivalent to about 100 and something. But here, they don't pay to see me. So I think I've done well.
Right here we have some of our rehabilitation equipment, and the doctor is going to explain to us more about the use and the significance, importance of these machines.
FOKO Heart is a cardiac center that not only takes care of the pathologies of the heart, but takes care of the patient in its entirety. Moreover, the heart, like every other muscle, has to be made strong by exercise. So we have a variety of equipment here that provide not vigorous exercise, but just the appropriate level of exercise for the kind of patients we are going to be receiving, which will make their heart stronger. People who are recovering from a stroke, people who are recovering from myocardial infarctions, all these equipment are here to help them.
Ladies and gentlemen, another beautiful time as we informed you where we are at the FOKO Heart Center. And of course, it's a pleasant time as we come together having one-on-one chat with the officials of this specialized cardiac center. That said and done, we are here with the managing director and also the general practitioner, that's a medical doctor who's also here with us. And of course, you'll be getting one-on-one exchange as we move on. Be with us. Madam Kema, let's get back to the issues at stake now. What prompted you and probably your husband to pick up this giant initiative, and why the choice of Cameroon and Boya in particular?
My husband, the lead consultant cardiologist, Dr. Frederick Kema, is a cardiologist, studied here in Cameroon, born and bred in Boya, secondary education, Lycée Moliko, and then went to Sase College for high school. Subsequently, he went to Italy where he studied cardiology. He actually has a PhD in cardiology, so he's not just a medical doctor. He's supposed to have a doctor title.
Okay.
And he practiced in Italy, in the UK, and now at times he works in France. So he will consult in French and English.
All right. Perfectly bilingual.
Perfectly bilingual.
All right.
And in Italian if it's necessary. So the plan was to have a cardiac hospital, some hospital, after he retires.
Okay.
But 2012, when we came to Cameroon, and again, his mother had stroke as well.
Okay.
So that prompted him to say, you know what, we need to have something in Cameroon, because I've got all this expertise. And each time you hear, even from friends, oh, my auntie has stroke, my mother has stroke, oh, my cousin died of stroke. You're having young people dying of stroke.
Okay.
So that's why we said, you know what, let's do something. The size, I won't say this is what we were envisaging.
Okay.
Because when we were designing the building with a renowned architect in London, Mr. Chris Nasser, he just gave like the rooms that he wants to have.
Okay.
Because he was designing based on the hospital in the United Kingdom where he works in London. So we never knew it would be this big. So we bought this piece of land and started the construction. It's only when you're a lay person, you've never built a house before, you don't really know what a 2,000 square meter means when you say that's what you're building a house. So when we started seeing some of the rooms really big, and we're like, oh dear. But again, like the size of the corridor is not a mistake.
Okay.
It was deliberate.
All right.
Because that's how corridors in hospitals in the West, that's how spacious they are.
Okay.
And the height that is so airy, all that was deliberate, that was not a mistake.
Okay.
So that was actually what prompted us to say, you know what, we need to have something. Because I used to say to him, you have all this expertise, you can't just go on retirement and then sit somewhere. We need to give back to the people.
All right.
So that's what actually prompted us to come up with this project.
Okay.
It's been challenging, but at least we are there at the end, and we thank God, because so far we've been stressed. I would say we never had anyone had an accident on site, so at least God has been on our side.
All right. Before I go over to Dr. Etel, I hope I call it well.
Yeah.
Now, let's find out from you, with this kind of giant initiative, FOKO Heart Center, a specialized cardiac center here in Boya, how did you canvass or get the fundings? Because from the sophisticated equipment we find, it tells us it's costing hundreds of millions of francs CFA.
We've sacrificed a lot. We started this building. We started the building in January 2014.
Right.
But the equipment, immediately we traveled back to London, January 2013. We started sourcing them.
Okay.
So we've been buying them bit by bit. Like you said, they have been expensive. For the building, it's a family initiative, just Dr. Kema and myself.
All right.
But for the building, we had financing. We had part financing from a credit union here in Cameroon, Mitayan Corporate Credit Union.
All right.
Those are the only people who actually believed in us. Because we don't live in Cameroon. We live in the UK. We only brought our pay slips, and they saw it, and they say, "Oh, we believe in your project."
Okay.
And of course, the collaterals are the land certificate of this building. So they are the only ones who actually believed in us.
All right.
So this building, we are privileged because we don't have loans left and right. So they are the only ones that will have as creditors. Other than that, everything is just us financing. We've been sacrificing for the past how many years. We've never had any proper holidays since 2013.
Okay.
It's just working.
Wow. All right.
Yeah.
Now, let me go over to Dr. Etel. Etel, FOKO Heart Center, they call it Specialized Cardiac Center, and then we find something written, inpatient care, cardiac intensive care unit, 24 hours emergency care. Now, when we have to come to FOKO Heart Center, what are some of the diseases that can push a patient to come to the center?
Okay. To come to FOKO Heart Center is for everybody, first of all, not just for people who already feel that they might have a cardiac disease.
Okay.
Because some people go half of their lifetime without even ever checking the condition of their heart. So FOKO Heart is for everybody.
Okay.
We do screening of all types when it comes to the heart.
Right.
And then for those who might be wanting to consult, maybe because they have symptoms, we handle symptoms such as chest pain, difficulty in breathing, fainting that's just sitting and fainting, and not able to lie on a bed without a pillow.
Okay.
Yes, and not able to walk any distance without getting tired.
All right.
Yes. And
all right. We get also from your flyers that there are some kind of services that are provided. We hear electrocardiogram, echocardiogram, you know the names. Sorry, I'm not from the medical field. And it gets quite interesting to hear echo stress test and all the like. So maybe you highlight us about some of these extra services that we don't find them in regular hospitals as per se.
Okay. For the echocardiogram is actually a cardiac ultrasound. It helps us get images and to detect the functioning of the heart without having to open up the patient. And we do two types of cardiac ultrasounds. We do the transthoracic and transesophageal. With the transthoracic, it is placed on the chest. And if we don't see what we need to see, we'll go from within that. We'll send a tiny camera on a cable down your throat so that we can see, since it's closer to the heart, we can actually see the different parts of the heart, the valves, the endocardium, the myocardium, the pericardium, and any other thing that we need to see, the vessels. So these are the extra and many other tests that we carry out here. Those are many other tests that you might not see elsewhere.
All right. We thank you for taking some time to give us these explanations. Now, let me come back to Madam Ekema. Now, Madam Kema. Thank you very much, Madam Kema. Now, when we look at the way you've put up FOKO Heart Center, with the sophisticated equipment, it tells us that probably getting treatment from there could also be demanded in terms of finance.
Yeah, finance, the magical word, isn't it?
Yeah.
The issue is, I think people are also, cardiac illness now in Cameroon is so prevalent that people now know cardiac treatment is not that cheap.
Okay.
Because the equipments are expensive to manage, expensive to run, and expensive to buy.
Okay.
With that said, we think FOKO Heart is privileged we are privileged to own our building,
okay,
which means we don't pay any rent.
All right.
So with that, we can be flexible with the price, with the treatment prices.
Okay.
So I don't think we'll be charging people millions,
all right,
for treatment that we can afford to charge you hundreds of thousands, because we can substitute some of those treatment costs with the fact that we don't pay rent.
Okay.
Because our most important outings will be salaries and a few suppliers that we work with.
All right.
So we are privileged to be in that position that we don't pay rent, so we can think about the patient.